Dr. Susan Van Dyke with us, and I was just thinking, you know, hair is such a decorator item with human beings, correct? I mean,
only on the head, evidently.
Well, apparently,
Yeah,
good thought there, Tanya. But I don't quite get it yet. We were talking, maybe it's my generation.
It's generational.
It's generational, isn't it?
Of course.
I mean,
And, you know, women with the body hair thing, it was the Americans that started with removing female body hair way back in around 1915. Women started shaving their underarms because some women's magazine came out with, you know, it's unsanitary and unladylike, and all of a sudden all American women had to have shaved armpits. European women didn't. I mean, that was completely a trend. It had nothing to do with any reality.
and wasn't it really a pain for women when they started having to shave their armpits, shave their legs, and they do it, I'm sure, on a daily basis?
Now, how do you know what a pain that is?
Well, no, I'm
No,
asking.
it's not. You know, it's
I'd love to
really
get
not.
you to
You
do
know
that.
what? It's really not, and that I don't
He said,
understand.
she said.
Do you know it only takes 1/2 second to do
you
that
know
in the bathtub?
that I had laser hair removal done about 15 years ago, so I have no idea how long it takes to shave your legs.
Really?
Really?
But what about before
Way
then?
back, it was a pain. You know, and
Thank you.
I
it
have
is not.
scars on my legs.
It is not.
I have scars from because I have bony legs.
But I mean, it's
But from
who
where
wants
the
a
razor came up where the bone
Yes.
was. I know,
Well, yeah,
it's
I've done
terrible.
that. I've got that shin bone before, and
Yes, and you
just
bleed all day
You
long.
slice it all the way up. It's horrible.
And you walk around with Band-Aids. I mean, that's not
But
attractive.
it only takes a minute to a half minute to shave your legs in the bathtub.
It's just in the category of there's something for everybody. You know,
I
if you're
know.
shaving your whole body, though, that might take a little longer.
So there is easier ways to remove hair, is what you're saying.
And laser hair removal was revolutionary about, well, as I said, I had it done when it was just in its infancy, and it's gotten so much better now.
And so now, does this mean it will never grow back?
It is FDA approved for the terminology of permanent hair reduction.
Okay.
Okay? Isn't that
The
politically
reduction.
correct?
The word,
Don't
the
you love it?
optimum word is there, reduction.
Yeah, the permanent's there, but the reduction is there. So that means that hair is hormonally driven. I spoke about women with PCOS. There's another trend going around with women, and they're called hormonal pellets. Have you heard of this?
No.
You know, hormone replacement. where
Right.
Okay. So the newest thing is hormonal pellets, where the pellets are injected under the skin, and what they're supposed to do is release the hormones uniformly over 3 or 4 months, sometimes longer. Now, what I'm seeing in my office is there's a certain number of women who are getting these, who get a nice peak in their testosterone, because the pellets can have testosterone in them. And
Voila, hair.
voila, and then they come in. I had one yesterday, facial hair, severe acne, and her voice was getting lower.
Ooh.
And she was on pellets. I've seen about a half a dozen patients in the last year now.
This sounds
on that.
like the results of early birth control pills would do this also.
The early birth control pills would have had a lot of estrogen, which
Right.
made women throw up all the time.
Yeah.
Not so much, they also had progesterone, which was a male hormone, but these pellets now have testosterone. And it's not bad for women to have testosterone, that's okay. It just seems that in some of these formulations, they're getting a very high peak when they're first done that tapers off. So in those people, now say they continue to have testosterone delivered at that level, you would continue to have to laser their hair because it will continue to stimulate.
So the best bet, again, is to go to the laser to begin with.
If you're, yeah, that's with the hormone pellets. That's at cross purposes. They're taking those pellets because of menopausal symptoms, or to improve their sense of well-being, for improvement of bone density, to improve libido. So there's all these reasons they're doing it. So this is a nasty side effect in some women.
What's the financial burden
On laser?
on laser?
Yeah, laser hair removal, say an upper lip might be $30, $40, $50 for a single treatment. Now you have to know, usually we'll do them in a package of 6 treatments, because the hair is only susceptible to the laser during certain growth phases. So you do come back once a month and do it. So if we do a series of 6, you know, 80–90% of the hair is permanently
But that
removed.
seems very reasonable to me.
Yes, and
for kind of a permanent situation.
it's very reasonable, because once it's done, it's done. It's about the same cost as waxing, and waxing will give you a reprieve for 6 or 8 weeks. You have to do it again.
Is this trend sweeping Europe? Because as even today, Europe is known more for underarm hair or leg hair or whatever. They are. Is it sweeping Europe?
Oh yes, absolutely.
So everyone's catching on this.
And it's huge in Asia. I mean, Asians, it's very important for them to be hair-free. They don't like hair at all. And I think the Europeans are just, you know, like we are.
So essentially, you were talking about the break, or I think it was the break that you were talking about this, but in way back when, they shaved everything.
Yeah,
I mean,
Queen Elizabeth's time.
Yeah.
Shaved or plucked eyebrows, eyelashes, the entire scalp, and that was considered beauty at the time. So it is very cultural, generational. You don't understand why a 30-year-old man wants a clean chest, but he probably doesn't understand why you do some things you do.
That's right. I'm sure of that.
I'm sure.
Yes.
Okay, now we have the scoop on this. Now, Jesse, don't ever permanently shave that beard. It's too attractive on you. You look, don't ever go hairless, Jesse. You look too attractive with that.
I agree. Anyway, doctor, as always.
We are going to do a demonstration of laser hair removal tomorrow at my office. So if anyone's down in the Scottsdale area, we have an open house between 10
is it
and 1 tomorrow.
Man or a woman?
Man. Who's the demo patient?
Yes.
It's most likely a woman.
Okay.
Yeah, probably a woman's legs.
Oh,
Good to see you again.
Love you.
Well, I guess if I want to be trendy, I'll be down to see you.
Do you want to volunteer? We could demo on your chest.
Maybe you better ask Gay first.
Probably should. Dr. Van Dyke, again, thank you very much. And you're located right down, very easy to find, right
on
off
Scottsdale Road, north of Fashion Square. Yep.
Thanks.
Very good.